The basic screening exam of the upper extremity includes testing strength of shoulder abduction, elbow flexion, elbow extension, wrist extension, finger flexion, and finger abduction. Shoulder abduction evaluates the deltoid, the axillary nerve, and the root of C5. Ask the patient to lift both of their elbows out to the side. Ask them to push up as you resist them. Elbow flexion evaluates the biceps brachii, the musculocutaneous nerve, and the roots of C5 and C6. Hold the wrist with your dominant hand and place your other hand over the muscle being tested near the elbow. While arm is flexed and supinated, ask the patient to pull the hand towards their face while you resist them. Elbow extension evaluates the triceps, as well as the radial nerve and the roots of C6, C7, and C8. Hold the patient's wrist with your dominant hand, and with your other hand over the muscle being tested near the elbow, ask patient to extend elbow while you resist them. Wrist extension evaluates the flexor carpi ulnaris and radialis, as well as the radial nerve and the roots of C6, C7, and C8. With the non-dominant hand, hold patient's forearm and place dominant hand on dorsum of patient's hand. Ask them to make a fist and bend wrist up against resistance from your dominant hand. Finger extension evaluates the extensor digitorum, the posterior interosseous nerve, as well as the roots of C7 and C8. Ask patient to keep fingers together and straight. Press against extended fingers with your straight fixed fingers pinky side down. Finger flexion evaluates flexor digitorum superficialis and profundus, the median and ulnar nerves, as well as the root of C8. Close your fingers on patient's fingers so that both sets of fingers are on the other's metacarpophalangeal joints. Ask patient to grip fingers and then rest movement with your fingers. Finger abduction evaluates the first dorsal interosseous, the ulnar nerve, as well as the root of T1. Ask patient to spread fingers out, demonstrating for them. Attempt to overcome the index finger with your abducted index finger.